Hey guys, it's Hina Sheth here at Rebalance Physical Therapy and Wellness in Philadelphia, Pennsylvania. And today we're going to be talking about pain or discomfort around or behind or in the vicinity of the eye. And so I first have to say, you want to make sure everything is cleared with your medical doctor, your family doctor, ophthalmologist, optometrist, and just get everything checked out. But let's say if you've had all that done and nothing is coming out that it's a problem. Well, the next thing that you may want to consider is that this could actually be a muscle problem. And the specific muscle that we're going to talk about today is called your sternocleidomastoid. I know that's a mouthful. This muscle actually is around the head and the neck, okay? And it attaches kind of up around, and I'll show you more specifically, around kind of the back of the head, underneath the ear, and then it attaches down into the collarbone. So if we look at that muscle a little bit more specifically, you can see here that it attaches kind of to the back of the cranium, which is the back of the head. It comes down across the side and down into the front, and it attaches to the collarbone right in through here, okay? And you can see this muscle on yourself. You can see it on me. When I turn my head, do you see how you can see part of it kind of like jutting out and through here? Okay, that muscle is your sternocleidomastoid. And it actually attaches not only to your collarbone, but part of it also attaches to your sternum. Now, when this muscle becomes problematic, and we're going to talk about what problematic means, when this muscle becomes problematic, it can cause, one of the areas of pain that it can cause is pain behind the eye, which is right in through here. So oftentimes you may feel that it's kind of around this forehead, around the eye. Maybe it comes down in through here. Feels like it's behind the eye, kind of underneath the socket. It can be tender in and around this area as well. Now, rarely does this muscle actually cause pain in the muscle itself. Okay, usually what ends up happening is it refers pain in and around this eye area. Now, this particular muscle can also cause pain in other areas, and you can look at kind of the follow-up videos from here, and we'll talk about the other areas of pain that it can cause. But this is just one of the areas that tends to be involved when this muscle is a problem. Now, this muscle can also cause visual disturbances. What does that mean? It can cause blurriness. Sometimes it can cause fogginess around the eyes, and sometimes it can even cause some light sensitivity. So just be aware of that. Now, why does this muscle become problematic? There's a variety of reasons, but some of the biggest ones that I can name is trauma. Have you been in a car accident, bike accident? Has something happened? Have you fallen? Did you hurt your head and neck? The other things that can cause this muscle to become a problem is postural changes. So are you on the computer all day with your head and neck kind of jutting out? Or are you doing a job? I've seen this in dentists, for instance, where they're in a particular position all day long doing work. And so that muscle can become problematic. So that's just kind of a few of the, 2 or 3 of the reasons why this muscle can become problematic. But there is a lot of other reasons. It can be compensatory from like other changes in the body. So say if you actually had a low back issue and you've kind of been carrying yourself around funny, well, guess what? It can cause changes kind of up the body and compensate into the head and neck. So just be aware that there's a lot of different reasons why this muscle can become problematic, but these are just some of the things. Now, what can you do to essentially see, is this muscle a problem? So we're going to save that for the next video. So check out our next video. But if this video was helpful to just piquing your interest as far as like, that could be happening with me, then subscribe to our channel and like our video, and I'll see you in the next one.